Yes.
And one of the questions was pain on the bottom of the foot is often attributed to plantar fascia. However, it's not the only structure in the region. What are several muscles in this region deep to the plantar fascia that also be causing foot discomfort?
Yeah.
I don't know if it's because I was so sick, but I didn't know how to answer that. I put a
So
long ass answer, but I didn't know.
so I mean this kindly. I hope you'll take it this way. I mean it as a compliment. The reason you are having problem with this, the problem with this question is you. But here's what I mean by that: you are overthinking it. The person who wrote the question wants you to just look at muscles of the foot and name some off and get you familiar and kind of get you looking at the chapter and get you kind of like excited about learning about the foot. And so there's not this really specific answer to that. You could have picked, flexor digitorum brevis, flexor hallucis brevis, abductor hallucis brevis, adductor hallucis brevis, digiti minimi, flexor digiti minimi. Anything on the bottom would have been underneath the plantar fascia. Anything would have answered that, really, if that makes sense. Yeah.
Yeah, I put a bunch of muscles.
So that's great. That's great. We wanted you to look at muscles of the foot. I mean, I didn't write that question, but I'm assuming the author too wanted you just to kind of look at the chapter. And you are I love this about you. You're like, what's to learn here and stuff. And they're just trying to introduce you. This is just an appetizer. Yeah.
That's what I
Yeah.
thought. I had a feeling, and I did look up the muscles and everything, and it was really cool because I saw that in my answer I also included like tendons from like the muscles in the calves
Oh, sure.
because I've learned they're highly related.
Oh, yes.
I added that in there too.
Yes.
And yeah, and I have one more question.
Please.
I was confused on the wording in the actual story, and it said he also reports some degree of tenderness near the anterior aspect of the calcaneus, but I wasn't sure what that. Like I know the calcaneus is the basically
The heel bone.
the Achilles heel. Yeah, the heel area, but I don't know how that can have an anterior because it's in the posterior. So I was like, is that at the bottom of the foot? Because that's the only available space I could think.
Um, your logic's excellent. Here's how it can happen. The calcaneus is actually the largest bone in your foot, and you just think of it as the ball of the heel, right? It's so big that it actually forms part of the arch, and you can actually touch a piece of the calcaneus. You can touch a piece of the heel bone from the top of the arch of the foot. Yeah,
Oh.
a lot of people don't know that. We will once we go over bones, but that's so. And I'm assuming that's what they mean by anterior. They also could whatever, but that is the front of the foot, and that's what they're talking about. And they're trying to highlight a unique feature of the calcaneal bone, right? Is that it is the heel bone, but it's so big that part of it actually forms kind of the arch, and you can actually touch it from the top.
Okay.
Not that
All
part
right.
of the bone, but that bone. That bone. Yeah,
Thank you.
it's a crazy bone. Feet are crazy. They should not work. You should not be able to support your guys' frames on those tiny little bones that are in your feet. And you certainly shouldn't be able to do it and run a marathon or go on a hike. It just shouldn't work, and yet it does because of fascia, really, and because of supporting arches and everything. Miss Avalos, talk to me.
Can you say that again about how you palpate the anterior side of that
Let me,
real quick?
yeah,
My brain kind of halfway through and had a glitch.
yeah, no, I can understand you're halfway through and had a glitch. Hold on. I want to see if I have a slide that shows, I'm looking at I don't do feet till tomorrow. Let me see if I have a slide, though, that shows this somehow. Bear with me 1 second. Yeah, this is not a great, Well,
You would have to palpate through
you can't.
the.
Let me show you what I mean. Let me show you a slide really quick.
Okay, thank you.
Because you're right, it's very confusing what I just said. You
I
can't.
don't want to wait till tomorrow either.
No. No cliffhangers. Let's do it.
No,
All right.
no.
This is not a great slide. We are going to do foot bones specifically tomorrow, okay? But if you look over here, right in here, this is actually the calcaneal bone also. Now, you can't palpate the heel from here. I don't mean that. But the calcaneal bone is so big that it also shows up in the arch of the foot here. So, this is the calcaneal bone right here. And if you saw a side view, you'd be able to see it. And I can try to find a picture of a side view, and you will see a side view tomorrow. But my point is, yes, it's in back. There's a heel in back, but that bone is long enough and big enough that it also pokes up here. It's crazy. So that's how that happens. Did that help at all? Yeah, okay. I mean, I know it wasn't a beautiful picture, but it lets you understand why we're like, oh yeah. Ms. Creel, please.
Is that where the medial malleolus is hooking around on?
Yes, roughly. The medial malleolus is kind of hooking around the talus, which we will get to too. But essentially, by the way, your malleoluses are the bumps on the side of your ankle. You guys should all be able to feel them. You should have a bump on each side of your ankle. If one of you doesn't, you are not typical. And that's okay. But all of us have, almost all of us, I'm pretty sure, have two bumps on each side of our ankle. The one on the outside of our ankles are called the lateral malleolus. And the ones on the inside of our ankle are called the medial malleolus. And they are parts of the tibia and fibula. So the medial malleolus is a bump at the end of your tibia. And the talus kind of fits up in there. And those two bumps actually act as pulleys for tendons to go through. Because you've got to have a way for the muscles up your legs to affect your feet. Right? Feet are just like hands. There are hand muscles and there are foot muscles, but the power of my hands doesn't come from these tiny muscles. It comes from these massive forearm muscles, right? And they puppet my hands. They have long tendons that hook up here. Well, in your feet, those tendons have to go around a curve, and that's what those malleoluses do. They kind of create a place for them to curve around and act like a pulley, so when your stuff up your leg pulls, it can grab stuff and pull toes and things like that. That's what the malleoluses are for. And we'll talk about all that, but that's a preview of coming attractions for those of you who can't wait. Awesome. Any other questions? No? Good. Okay. So we are going to go over bones of the leg today. Before that, though, I want to do really quick review again because, I know some of you, well, many of you emailed me, called me, wrote letters of complaint that I didn't call on you yesterday. You were angry, and I don't blame you. All right? I want to let you know, each and every one of you, that I will try to compensate for that. So, yeah, I just want to ask you some quick questions to see if we remembered highlights from yesterday. I will not be asking you 35 questions at all. But also that way we'll get on tape some of the highlights, as Ms. Osuna was pointing out, get on tape some of the highlights of things that we talked about yesterday, right? Cool. Okay. Mr. Craven, I know you're not feeling well, but I have a quick anatomy question for you.
Sure.
Thank you, sir. Mr. Craven, can you tell me what the 4 rotator cuff muscles are? The ones, that cross over the glenohumeral joint.
The supraspinatus, infraspinatus, teres minor, and crap, I forget.
You're doing great. You told me the one above the spine of the scapula, the one below the spine of the scapula, the one that goes with that one, and then you just need to tell me the one that's under the scapula. Under.
Infraspinatus?
You know what? One of the things I'm thinking about doing over my winter break is taking a special boat ride in one of those boats that goes under the water. What do they call those things that go under the water?
Oh, subscapularis.
Subscapularis! Thank you. Okay. So, what were those 4 muscles again?
Subscapularis, infraspinatus, supraspinatus, and teres minor.
Good. Which 2 of those go together?
Infraspinatus and teres minor.
Thank you, sir. And why do they go together?
They're synergists.
Yeah, I like that. They're synergists. And they are kind of in the back of my shoulder here. What action do they do?
Laterally rotate the humerus.
Yeah, I like that. Lateral rotation of the humerus. That was great. So what action does the subscapularis do that's actually in front of the scapula?
Medially rotate the humerus.
Yes. And what does the supraspinatus do?
Elevate. Or abduct.
Abduct. Dude, you knocked it out of the water. Good job. Good job. And that's his sick brain, everybody. When he's well, bam. Even more amazing. Thank you, sir. Thank you. Mr. Bose.
Yes.
Yes, Mr. Bose. Hi. Hey, Mr. Bose, what are the deep 6 lateral hip rotators?
Let's see. Okay. Gemellus inferior, gemellus superior, obturator externus, obturator internus. That's 4. Piriformis. And quadratus femoris.
Yeah. Good. Now tell him to me one more time with confidence.
Okay. Gemellus inferior, gemellus superior, obturator externus, obturator internus, piriformis, and quadratus femoris.
Beautifully. By the way, that was
Yeah.
beautifully done. Everybody, I did that on purpose. That wasn't just a joke. If you say something and you're not sure of it, you remember not being sure of it. So when you get it right, you want to go back and say it with confidence. Miss DeBose, which one of those is the most superior of the 6?
Is it the gemellus superior?
That is a great guess, and many people make that guess. And the gemellus superior is superior to the gemellus inferior, but it's not the most superior one. This one pinches the sciatic nerve and happens to be the most superior.
Oh, the piriformis?
Yes. Which one is the most inferior?
Oh, is it the quadratus femoris?
Yes. Which 2 are most palpatable?
Hold on.
Think about how I ask questions.
Is it the piriformis and the quadratus femoris?
Yes! So, the other 4, gemellus superior, gemellus inferior, obturator internus, obturator externus, are all found between those.
Okay.
Awesome. Thank you very much, Mr. Bose. That was great.
Thank you.
Awesome. Miss Everson.
Sorry, I'm struggling with it.
No, you're doing fine. Miss Everson, what are the 3 erector spinae muscles that run up my back?
There is the iliocostalis, the longissimus, and the spinalis.
Yes. Can you tell me? You did perfect. That's a perfect answer. Can you name those for me from medial to lateral?
Spinalis, longissimus, iliocostalis.
Beautiful. By the way, it's fine naming them from lateral to medial. I just wanted to see if you knew where they were. That was fantastic. If you remove the spinalis, there's some crisscross shoelace muscles underneath it that go by 2 names. What are those?
I want to call it the rotatory.
That works great. Rotatories. Rotatores.
Yeah, and multitivity.
Yeah, multifity. Yeah. That's beautiful. The multifity. Oh, shoot, I just gave that one away. Never mind. All right. That's going to be like, which one goes down on the sacrum? But I just told you it's a multifity. Anyway, which of the 3 spinal erectors that you just told me inserts into the mastoid process?
The longissimus.
Yes! You are dead on right. Okay. That's it. Thank you. Mr. Godot. Mr. Godot?
Sorry, I was looking for the button.
No, you're good. Mr. Godot. So on my temporal bone, I've got this mastoid process. It's this bump. Can you tell me 3 or 4 muscles that insert into that mastoid process? Miss Everson just told us 1.
Say that again?
It's a lot. You've got this mastoid process here, and there's actually 4 muscles, but I only expect you to know 3 that insert in here. Miss Everson just told us 1. One's one of your erector spinae muscles, and she just told us which one inserts in the mastoid process. The other muscle that inserts into the mastoid process helps you say your prayers, and the other one connects your cap to your spine. Those are clues for those 3.
Splenius capitis?
Splenius capitis, excellent. Goes out diagonally, boom. Excellent. Yes.
Longissimus capitis?
Yeah, just yeah. Actually, by the way, he's not wrong by saying longissimus capitis. Some people name the sections of the longissimus. But anyway, longissimus capitis, yes. Bam.
And then the sternocleidomastoid.
Bam. Dude, that was awesome. Okay. Thank you, sir. You're done.
Thank
That was
you.
amazing. It's amazing. Miss Green.
Hola.
Hola. Miss Green, what are the names of the 3 hamstring muscles?
That'll be the biceps femoris semimembranosus and the semitendinosus.
Yes. What are the 2 actions of the hamstring muscles?
Extension of the hip and flexion of the knee.
Nice job. What is the exception to that?
I
I don't know if I asked that the best way possible. I can elaborate if you need me to.
was gonna say what you.
That answer is correct, and it'll serve you for the rest of your life, and it's absolutely fine. But if I was being really nitpicky, I'd say it's slightly wrong because there's an exception to that. One of these muscles that's not quite true about completely. One of these muscles doesn't exactly fully do an extension of the hip and a flexion of the knee. Not completely. I don't know how to tell you.
Okay, so the biceps femoris does both,
Yes.
but the other 2 just flex at the knee. Extend the hip. Yeah.
So the biceps femoris has 2 heads, right?
Uh-huh.
Along
Oh,
the
the short.
yeah.
Mm-hmm.
What are the actions of the long head?
Flex the knee.
And extend the hip, just like that one.
Extend the hip, yeah.
The short head doesn't make it up to the hip. So what's the action of the short head of the biceps femoris?
It only flexes at the knee.
Yeah, thank you, ma'am. And sorry, the question was very confusing, but you're
No,
good.
no.
You're golden. So everybody, all 3 hamstrings definitely help to flex the knee and extend the hip. And what Miss Green said in the beginning is the most important thing to remember. But if you if you want to get really nitpicky, the biceps femoris, the 2-headed muscle on the femur, 1 head only goes across the knee and only helps with the flexion of the knee. That's all. Cool. Thank you.
Thank you.
Miss Lee.
Hi.
Hi, Miss Lee. Try not to be nervous. I'm going to just ask you to say some muscle names, and if you don't know them, I will say them with you. We're just practicing pronunciation. So,
Okay, thank you.
thank you. Do you know the 3 calf muscles?
3 calf muscles.
And if you don't, I can.
Gastrocnemius, soleus, and plantaris.
Wow, that was fantastic. I don't even have a comment. That was perfect. Do you know the 3 hamstring muscles?
Biceps femoris, semitendinosus, semimembranosus.
Oh my God. Do you know the 3 gluteal muscles? Yes.
Maximus, Medius.
Yes. But it's gluteus maximus.
Oh, gluteus medius, yeah.
Okay. Do you know the 3 erector spinae muscles that go up and down my back?
Spinalis, longissimus, iliocosdalis.
Oh my God. You're amazing. Okay. So I gotta ask you a couple more just for practice. Can you tell me the 5 abdominal muscles?
External oblique, internal oblique, quadratus, lumbalis, and rectus abdominalis, and transverse abdominal.
Yes. Just to make sure, it's quadratus lumborum, but you did great. You did great. You don't even have to repeat.
Okay.
Can you just a couple more questions. Can you tell me the 4 quadriceps femoris muscles?
The quadri muscles is vastus, intermedius, vastus, lateralis, vaginus, medialis, and rectalis.
Rectus femoris.
Okay, rectalis.
Yes. Okay.
Rectus femoris.
Thank you. Awesome. Almost done. Can you tell me the 5 hip adductor muscles that are found inside my leg here? I can sit with you if you need me to.
Which one?
So that would be like adductor magnus, adductor longus, adductor and gracilis and pectineus.
Adductor medius. No, I don't.
Do you want me to say them with you, Miss Lee? We can say them together. Don't worry, you're doing great. We're just practicing. Do you want to say them with me? Can I say them with you?
Yes,
Okay.
I can.
Just
say with you.
just repeat after me.
Okay.
Adductor magnus.
Adductor medius.
Magnus. It's hard.
Magnus.
Perfect.
Okay.
Adductor longus.
Adductor longus.
Yes. Adductor brevis.
Adductor gravis. I know that. Okay.
Okay.
And adductor magnus and pectineus.
Pectineus and
Pectineus
that was great. And gracilis.
and gracilis.
Beautiful, beautiful, beautiful.
Yeah.
Last question.
Okay.
What are the 4 rotator cuff muscles? This is like the supraspinatus, infraspinatus.
Okay. Infraspinalis, suprascapularis, supraspinatus, teres minor.
Thank you, ma'am. Thank you, thank you, thank you. Thank you. That was great. You're done. You take a break. That was great.
Okay, thank you.
That's got to be really nerve-wracking. Mr. Snell.
Yes.
Mr. Snell, I had a question. Oh, yeah. Mr. Snell, what are the 3 calf muscles?
Gastrocnemius, soleus, pectoris.
Yes. Which 2 cross over the knee joint?
Wait, what was that, I'm sorry?
So all 3 cross over the ankle joint. That's how they allow you to do a plantar flexion. But only 2 cross over the knee joint. Do you know which 2 those are?
The gastrocnemius
Yes.
and the soleus?
No.
Plantaris.
Yes. So which 2 cross over 2 joints?
The gastrocnemius and plantaris.
Awesome. Thank you, sir.
Thank you.
Miss Suriel.
Yes, Mr. Tapscott.
Miss Suriel, what are the 5 hip adductor muscles that are found between your legs? And if you need help, let me know.
Is the lateral hip abductors?
No, you're thinking lateral hip
the
rotators.
abductors of the hip.
Yeah, you got like an adductor big and long and
Okay.
short and yeah.
We had the adductor brevis, adductor longus, adductor magnus, gracilis, and pectineus.
Yes. Which one of those is the longest of all five?
The gracilis.
Yes. Yes. And where does it insert?
Oh my God.
It inserts into a little birdie's foot.
Hmm.
Inserts into the goose's foot, but in French.
Ah, that one, I don't know.
That's okay. Don't feel bad. I don't think a lot of people know. It inserts into a place called the pes anserinus, which means goose's foot. I think in French. I don't know. But it inserts into that. It's called the goose's foot because two other muscles insert there, so it looks a little bit like a goose's foot. It's down on the tibia. It's down on your leg down here, but it inserts in this place called the pes anserinus. That's it. You're good.
That one came a lot on the test, but yeah, that's one of the things that it's still like it takes time for me to grasp because I think that new word is new for me.
Oh gosh, yes, it is new. It is. You jumped back in too. It's gonna be a little tough. And by the way, for all of you, if you feel challenged, I hope you do. This is a tricky place in the course, right? Because you have enough information where I can start to extract stuff from you now, right? We're not just learning our ABCs anymore. So yeah, good stuff. Mr. Lee.
Yes, sir.
I could not forget about you, Mr. Lee.
Oh, thank you.
Mr. Lee, same thing. We're just going to practice saying some stuff. Can you tell me, and so if you don't know them, I'll say them with you. Can you tell me the three calf muscles?
Gastrocnemius, soleus, plantaris.
Beautiful. The three hamstring muscles.
Biceps, femoris, semimembranosus, semitendinosus.
Beautiful. Three gluteals.
Gluteal, maximus, medius, minimus.
Beautiful. The three erector spinae muscles.
Sabinolus, longissimus, iolixtalis.
Ah, I love the way he says it with conviction. Can you tell me the five abdominal muscles?
5 abdominals, external oblique, internal oblique, quadratus lumbar, rectus abdominis, transverse abdominal.
Jeez. We're getting close. You're doing great, sir. Great.
Thank you.
Can you tell me the four quads?
4 quads. Vastus intermedius, vastus lateralis, vastus medius, rectus femoris.
Beautiful. And what are the five hip adductors?
Oh my God.
Sorry.
Adductor brevis, adductor longus, adductor magnus, gracilis, pectineus.
Oh my gosh. Last question, sir.
Yes, sir.
You're great. What are the four rotator cuff muscles?
Rotator cuff muscles.
And I can tell you, if you it's like the supraspinatus, infraspinatus.
Spinatus, supra subscapularis, supraspinatus, teres minor.
Yeah, good. You're done. Thank you, sir. Good job.
Thank you.
All right. I think I'm sure that I missed somebody. Don't get me wrong. Between yesterday and today, Miss Carrillo, I didn't call on you yesterday because you weren't feeling well, and so but I marked you down as having done your test, so I was going to call on you, and then I didn't call on you today. Oh my gosh. Okay, Miss Carrillo, can you talk? Basically, okay. Unmute yourself, ma'am. All right.
Sir, head chef.
So everybody, Miss Carrillo's kindly agreed to summarize everything for us today, so we have it on tape. She might get stuck in a few parts because she's human, and I will help her, and that's all okay. And she's not feeling her best, so we will take that into account too. But here are important anatomy things that we have kind of learned so far. This is not an exhaustive list, but it's stuff that I really feel you should know, and you'll definitely want to know for your year-end test. You'll definitely want to know, by the way, in your massage practice. So, Miss Carrillo, what are the 3 calf muscles?
Gastrocnemius, soleus, and plantaris.
Yes. Which 2 cross over the knee?
Gastrocnemius and plantaris.
Yes. Now, everybody, the reason I keep asking that is because they become structurally important in fascial lines if they cross over 2 joints. And that means that all 3 calf muscles plantar flex you, but 2 can actually also help you flex your knee. So when people are having knee problems, it's important to know that. That's why I keep making a big deal out of that. What are the 3 hamstring muscles?
Biceps femoris, semitendinosus, semimembranosus.
Yes. Which one of those muscles is most lateral?
The biceps femoris.
Yes. And that's just so you can find it, everybody. The semimembranosus and semitendinosus, it's really actually, you can argue back and forth, but they're both medial. That's for sure. What are the 2 actions of the hamstrings?
Flexion of the knee and extension of the hip.
Yes. Which gives them the nickname what? Let me give you a clue.
Is it like walking?
Yes.
Is it like the walking muscle?
Yeah, walker's muscle, walking muscle, who knows? Because you actually do those 2 little movements to walk. That's awesome. What is the exception to this rule where you just told me the action is the flexion of the knee and the extension of the hip?
The exception, do you mean like the head?
Yes.
Like one of the heads, the short head?
Yes. Short head of what?
Of the biceps femoris.
Yes, and that one only does what?
Flexion of the knee.
Yep, because it never gets up to the hip, everybody. Never makes it. Okay, awesome. I'd just like to say, by the way, you're doing excellent right now. So,
Thank you.
what are the 3 gluteal muscles?
Gluteus maximus, gluteus medius, gluteus minimus.
Thank you for telling them to me from posterior to anterior. Which one is my major hip extender?
That's the gluteus maximus.
Yes. Which, by the way, is also my major hip lateral external rotator.
Did you ask me which one? Or
Yeah, which one? Which one of those?
the lateral rotator.
Of a gluteus maximus. I'm not talking about the deep 6.
Oh, the deep 6.
No,
I'm
no,
so
no,
sorry.
no. I'm not talking. I'm not talking.
Gemellus
No.
superior.
Stop. I'm not talking about the deep 6.
Oh, I'm sorry.
Don't be sorry. Don't be sorry.
So the medius, I know does the adducting.
If you wanted to pull my leg kind of behind me, which gluteal muscle might you be?
I want to say the maximus.
I want you
the
to say
medius.
maximus. So
Maximus.
maximus is your powerful hip extender and a powerful lateral hip rotator. Cool. Which gluteal muscle helps me abduct?
The medius.
Which one helps me do a flexion of my hip?
Minimus.
Cool. Thank you. Wonderfully done. So sorry about all the other questions. What now are the deep 6 lateral hip rotators that are found underneath my gluteus maximus?
Gemellus superior, gemellus inferior, obturator internus, obturator externus, piriformis, and quadratus femoris.
Yes. Which one is most superior?
Piriformis.
Which one can pinch the sciatic nerve?
Piriformis.
Yes. Which one is most inferior?
Quadratus femoris.
Yes. Which 2 are most palpatable?
Piriformis and quadratus femoris.
Right, which means I can find the other 4 between them. Thank you very much. That's awesome. I'm trying to keep track of everything I wanted you to do. What are the 3 erector spinae muscles?
Iliocostalis, longissimus, and spinalis.
Good. Can you list them for me from medial to lateral, just so I know you know where they are?
Spinalis, longissimus, and iliocostalis.
Good. If I peel back the spinalis underneath it, I will find 2 shoelace-type muscles. What are those?
The multifidi and the rotatories.
Yes. Well, which one of those is longer and is also found in the sacrum?
Multifidis.
Thank you. Which spinal erector muscle, back to the spinal erectors, which spinal erector muscle also inserts into the mastoid process of the temporal bone?
Longissimus.
Thank you. Let's talk about the mastoid process temporal bone. Can you tell me the 3 or 4 muscles that insert here? You just told me 1.
The longissimus, the splenius capitis, the sternocleidomastoid, and I don't know the pronunciation, but the digastric.
That's pretty good. Digastric, yeah. which is a suprahyoid bone a muscle we haven't even learned about yet. Beautiful. Okay. What are the 4 rotator cuff muscles?
Supraspinatus, infraspinatus, teres minor, and the subscapularis.
Yes. Which one or ones does a lateral external rotation, lateral rotation?
The it couple, the infraspinatus and teres minor.
Well done. Which is why we always say those together. Thank you. Which one lets me do an abduction?
Supraspinatus.
Yes. Which one lets me do a medial rotation?
Subscapularis.
Beautifully done. Okay. I had another question in my brain. It just went away. Sorry. I was trying to think of something else. That's beautifully done. Cool. Miss Carrillo is now the head chef. Yeah. She is cooking up some knowledge. I'll tell you that. What are the 5 abdominal muscles?
The rectus abdominis, external oblique, internal oblique, transverse abdominis, and quadratus lumborum.
Yes. Which one of those is known as the hip hikers?
Quadratus lumborum.
Yes, because they can create elevations of the hip, right? Or flexions of the spine to the side. Awesome. We won't get into rotations yet. What are the 5 hip adductor muscles found between your legs?
Pectineus, adductor brevis, adductor magnus, adductor longus, and gracilis.
Beautiful. Which one of those is most posterior?
Adductor magnus.
Adductor magnus. Cool. Thank you. By the way, it's still found between my legs, so it's most posterior. The other ones are on top of it. Which one of those is the longest one?
Gracilis.
Where does it insert?
The pes anserinus.
Yes. Which is on what bone?
Is it the tibia?
Yes. Medial proximal shaft of the tibia. Beautifully done. Awesome. What other 2 muscles insert into the pes anserinus?
Gracilis and semitendinosus.
You already told me gracilis, and you're right about semitendinosus.
Sartorius.
Sartorius, which is not in a muscle group, right? You are smoking it. What are the 4 quad muscles found on my anterior lateral compartment of my femur?
Rectus femoris, vastus medialis, vastus intermedius, and vastus lateralis.
Which one of those helps me extend my knee?
Rectus femoris.
I phrased it as a trick question.
Oh, okay.
You are right, by the way, but there's more rightness to this answer. Which one or ones help me extend my knee because they cross over my knee?
This one's a little harder.
Which it is. By the way, you've done so good, and I appreciate you just helping me sum this up. We're just having fun. But which one or ones would insert into your kneecap, your patella, and then insert into your tibial tuberosity?
If I had to guess, I would think it would be the vastus intermedialis because it's the most middle. And
yeah, that's a good guess. Is it possible that all 4 insert into the patellar via the patellar tendon and insert into the tibial tuberosity via the patellar ligament?
I guess, yeah.
So all 4, by the way, don't feel bad. All 4, everybody, all 4 of your massive quads, that's why they taper back down in at your knee. You see bodybuilders, they got these huge thighs, but they don't have huge knees. They taper back in because they're all coming to meet at the kneecap. And then they hook into your tibia, and that's why they all help with a leg extension. But I messed you up because I said which one, and so you thought which one does a hip flexion. And only one does a hip flexion. Which one is that?
And that's the rectus femoris.
Thank you. Okay, we are almost done. You have answered like all the stuff that I kind of feel like people should just kind of, this base knowledge kind of thing. So, this one's tricky. Can you tell me the muscles that could cause a flexion of the hip and therefore an anterior tilt of the hip?
Oh, there's so many.
There are so many. There are so many. So just list off some.
Okay, so the rectus femoris, because that definitely goes on the hip.
Yes.
I remember that a lot of the adductors a lot of them are interior.
They are.
The adductor.
Sure.
Except the adductor magnus. The
Yes.
adductor magnus is in the ischial tuberosity, if I remember.
And by the way, guys, she's taking it another level. We actually haven't mentioned this yet, but it is true. Some of your adductors are far enough forward that can help with the flexion of the hip. Yes. So, what else, though?
can sartorius as well?
Definitely. Sartorius is in front, basically attaches the same place rectus femoris, yes. What else is in front? Kind of.
I know there's tensor fascia latae, and then there's also gluteus minimus.
Yes. Yes, and the only one I want to hear now, it's not really one, it's kind of two. And if I were to stick my fingers in deep inside my belly button and put them down here, it kind of goes from here.
Oh, the psoas major, the iliopsoas.
Yes, which is
The
two muscles,
iliopsoas.
psoas major, iliacus. Okay, thank you, and by the way, thank everybody for just listening to that. But what I wanted to get on tape, Miss Creel, you did great. Just great. I'm sure I missed a few things, but that is a very good list that we now have on tape of everything that you should be kind of retaining and thinking about that we will use later. There are a few more things we didn't get to, like all the stuff that attaches to the coracoid process, which is actually three muscles, just to throw this in. It's the coracobrachialis, the pectoralis minor, and one of the heads of the bicep, all attach to the coracoid process. That's an important thing to know too. But these are very typical Tapscott questions to ask people. Yes, thank you, Ms. Dimitruk. All right, everybody, I think it's a good place to take a break. We'll come back, and I promise we'll discuss the foot bones. The lower leg, and tomorrow we will learn, I shouldn't even say the lower leg. I should call it the leg. Because remember that our leg is our leg below our knee, and above our knee is our thigh. So, we're going to learn about the bones of the leg and knee. And tomorrow we'll learn about the bones of the foot. And there's not a lot of bones, so it's not the bones that are so important, although it really is helpful if you all know you have a tibia and fibula below your knee, and that the tibia is the thicker one and the more medial one. The tibia is the thicker one and the more medial one, which means the thin little fibula is on the outside of your leg. Yeah? Yeah. Let's just check on that really quickly. Miss Hendrickson.
Hello.
Hello, Miss Hendrickson. Which leg bone is the thicker and more medial one?
The tibia.
Thank you, ma'am. Thank you. Miss Young.
Hello.
Hello. Which leg bone is the thinner and more lateral one?
Which leg bone?
Yeah.
The fibula.
Thank you. Awesome. Okay. Now I feel comfortable moving along. All right. So let me share my slideshow, everybody. And again, by the way, these bones are important, but what's really important is the bumps on the bones, because later muscles will attach to those bumps on the bones. I'm also going to point out the location of the pes anserinus, since I seem to be obsessed with it lately, so that we know where that is too. All right, moving right along, let us take a look at a little slideshow. And then we should have time to release homework early so that you guys can do it. I do not want this to be a hard week for you. I know that after that test and the fact that your break is coming up, that I'm lucky that you're still here. So, okay. So here we go, right? We're going to be kind of talking about the knee on down. This is your femur up here. And your femur does have condyles on it, bumps to the side, right? And here's your tibia down here. And your tibia has condyles on it too, bumps on the outside of it. And this beautiful kneecap is called your patella. Every gal and fella has a patella. And the patella is a very special bone. It is one of 10 of these special bones in your body called sesamoid bones. It's wrapped in tendon and ligament. And the reason is the quads. So above here on this femur, way up out of the slide, you've got the vastus lateralis, the vastus medialis coming in over here, the vastus intermedius, and the rectus femoris, and they all come down and attach to the patella with patellar tendons, right? Well, that's 4 big muscles wrapping tendon around this patella. And this fella is wrapped in a lot of fascia because of that. And then all that fascia comes together and makes a ligament that hooks into the tibial tuberosity, this bump below your knee that you should all be able to feel. And this is why when your quads contract, you do a leg extension. They all come together and hook to this patella. And the patella kind of floats over the front of both these bones here. Remember the other important thing about the patella. It is keeping, when I go down and do a squat, it is keeping my femur from blowing out over my tibia. This should keep you awake at night. This is a terrifying proposition. This is why you need a kneecap. Really, it would be bad news. You'd probably bleed out in about a second and a half. It really does. When you go down like this, there's an angle here that all that weight, when you're doing squats at the gym, Mr. Jones, that you've got, let's say you got 300 pounds loaded on your back, that's 300 pounds that wants to slide out here. So the power of your quads wrapping this sesamoid bone, it's called a sesamoid bone because it's wrapped in fascia, wrapped in these tendons and hooked down to your knee is what keeps it all together. We should give gratitude for the patella tomorrow because really, I mean, yeah, patella is a hard-working fella. All right, so that's your kneecap. Mr. Jones, please.
I was just going to say, if you are lifting a weight that is kind of too heavy, you'll feel it in the patella.
Yes, it goes under a tremendous amount of strain. You're absolutely right. Yes, you will.
It probably ends up being essentially your weak point.
Yeah.
While under an extreme load. So
I would agree.
If you're feeling weird right there, too much.
Yeah, back off. You're absolutely right. And that patella rides in a little tract, too. And if it's a little bit off the tract, you feel that, too. Miss Osuno, you raised your hand briefly. I just want to make sure I didn't miss you. But maybe you changed your mind.
Yeah, I did, but I don't know. I was going to say, when people, like, their kneecap gets out of place,
yeah,
and, like, people, like, slap it in,
yeah,
if their like adrenaline is going high enough, can they still technically run, or are you automatically going down?
So I was confused. You said they slapped it back in.
Yeah, people just like
get
it back in.
Then they can, their adrenaline's running. They can keep going, sure, because the patella's back in place, so their knee's not going to break in two. I don't know, how much they rub stuff slapping it back in, but it needs to get slapped back in at some point. Yeah. I wouldn't run without slapping it back in, but yes, they could. Yes, they could. Absolutely. Miss Suriel, you raised your hand.
Mr. Topsner, I'm sorry. I feel my question may be like a little dumb, but it just came out of my mind. So because in the leg we have these two bones, the fibula and the
tibia.
The tibia. So I'm just thinking about our arm and our arm. We have the radius and the ulnar? So why how the elbow works different because I feel it's like a kind of the same, our elbow rotates, but it's just why we don't have a patella there.
Yeah. So it was not dumb, by the way, and I'm not just saying that to be nice. That was not a dumb question. The fact that she is comparing legs to forearms is a very good comparison. This is why people believe, and you don't have to, it doesn't have to be everybody here. I'm not making an argument for evolution, but this is one of the reasons people believe in evolution. They're like, look, the hands used to be feet, and then we came up off all fours, and they adapted to be a different way, and the feet stayed the way they are. Because both legs have 2 arm bones, both hands have 2 arm bones. Both feet have 14 phalanges, both hands have 14 phalanges. Both feet have 5 metatarsals, both hands have 5 metacarpals. The feet have 5 or 7, depends. Let's go with 7 for this argument. The feet have 7 kind of tarsal bones. The hands have 8 carpal bones. They're really similar. So, Ms. Suriel, it's not a crazy comparison. But the reason the elbow doesn't have a patella is it doesn't go over nearly the force that the legs do. That's the reason. You need patellas when there's lots and lots of force. And nobody in the world can bench, well, nobody in the world should be able to bench press more than they can squat. So, you know, some of the world records for, I mean, you might never do squats, and so therefore you always do bench press, and therefore you can do more that way. But I meant the body, if you work out your body evenly, nobody, top bench presses in the world, or what do they ride around? What are they, Mr. Jones, what, 500 pounds? And top squats in the world, top squats are where they were hovering around 1,200 now. So they're more than double, but they're at least double what a bench press is. It's just our arms aren't actually designed to take that force. Your body is designed to have this powerhouse down here that carries you places, and these little arms to manipulate. Think of T-Rexes. You know, T-Rexes, if you're a T-Rex and you're happy and you know it, clap your hands. T-Rexes have these powerful legs and stuff to get them someplace. What are their hands for? Their hands are for eating. Just bite you in. They're just sitting there to pick their teeth and stuff. So anyway, your elbows don't go under as much force. Did that answer your question, Ms. Suriel?
Yeah, I'm also thinking and checking about the joint in the elbow. It's just like why it's so different. But the joint also, I believe a few months ago we were checking on the joints, and I believe that joint, it has like a little cup or something.
It does. She's right, by the way. The ulna actually kind of creates a little bit of a cup for the humerus, and it makes a really good cup there. You're absolutely right. And your knee is not like that. You're right.
One last thing, Mr.
Yeah.
Tapscott, I sent you an email for a permit today. If you can just please tell me if I can have it or not, please.
I saw the email. I didn't read it. I saw the subject line.
Oh, okay.
I don't think you need my permission, though.
Oh, okay, Mr. Ibarra just told me to let you know.
Oh,
if
yeah.
you approve, then I'll be fine.
Oh, thank you. I can almost pre-approve it without reading it. So, but I'll look at
Okay.
But I'll look at the minute
Thank
I
you.
get a chance. Yeah, thank you, Miss Suriel.
Okay, thank you.
If you're asking about missing class, I mean, of course you can miss it. You just have to make up the time. I mean, that's kind of, yeah. But thank you for letting me know.
Thank you.
Yeah. Okay, so let's go back to the leg here. And by the way, I want you guys to draw those comparisons between feet and hands for whatever reason, because it helps you kind of memorize the bones and stuff, right? Okay, so we've got a femur that sits on top of a tibia. It does not sit on top of the fibula. The fibula actually joins to the tibia, right? So this is a tibula-femoral joint, or a tibiofemoral joint. Or they call it a tibiofibular joint, which is what I should have called it. I apologize. I mixed it with femur. Tibiofibular joint. Thank you. Tibiofibular joint. You've got two, by the way, because they touch in two spots. So you've got a proximal one and a distal one. But what I was trying to say, and I said improperly, is the fibula does not articulate with the femur. The femur is just touching your tibia here. And it carries that weight straight down, and it rests on top of this very important little bone down here called your talus. And your talus actually rests on top of your calcaneus bone. But your talus is this 50 cent size, 50 cent piece size bone. And it takes the whole weight of that and helps it articulate, and it's why you can bend at your ankle. It really is. And that's why they call this joint, I don't like this name, but they call it the talocrural joint. That's your ankle joint. I wish they called it the talotibial joint, because that's how we name other joints in your body, but they don't. Remember we called the front of your shin your crural region, so they call this the talocrural joint. Talotibia would be fine with me. But anyway, we're going to call it the talocrural because everybody does, and that is your ankle joint. And knowing actual joint names is important. Okay? Like, especially for the end of the year, but it's important in your clinical work. It really is. So your ankle joint is called your talocrural joint. And your knee joint is actually called your tibial femoral joint. Those two joints are crucial, right? We will learn other really nitpicky joint names that aren't as crucial for you to memorize, but you should know the actual anatomical name for your knee, anatomical name for your ankle, as well as your hip and, you know, your shoulder and your wrists and things like that. So anyway, then we come down, and this was the question in your book, by the way. I was not counting the talus and the calcaneus as tarsal bones. But this group of 5 bones down here, many people refer to as the tarsals. They have different names, but there are 5 bones. Just like there are, we haven't gotten to this yet, but there are 8 bones in your wrists that all live right here. And they all have names, but we call them the carpals. So this is a group of bones down here, kind of makes up the arch of your foot, and we call them the tarsals. And we're gonna bore down on this in a minute. Then, exactly like your hand, there are 5 metatarsals, these long things, and then there's all these little phalanges. Yeah, right here. Who can tell me what phalange this one is? Miss Rader, which one is this?
The first one?
Yeah. Oh, shoot. Let's go back. The one can you see the one I'm pointing to? Yes. Oh, you said the first one.
Yeah,
yes,
the first one.
It is the first one, but so is this one.
Oh, okay. So the distal phalange number 1?
Yes. By the way, she said it exactly perfect. This is distal phalange number 1. Miss Savarino, what's this one? Really hard to see.
I have horrible eyesight. Hold on.
All right.
That's the proximal distal. No, yeah, number 5.
Wait,
Proximal phalange number 5.
Yes, she nailed it, everybody. It's number 5. All 3 of these are number 5, and she called this the proximal number 5. Yes. Thank you. Really well done. And Mr. Singletary.
I hear you.
You were going to answer too, but let me give you a different one. What is this one in the middle right here?
I can barely see that.
All right. It's not this one, and it's not the one on the tip. It's between those two, next to the big toe.
Is that the interphalangeal? If that's what your point. I'm sorry, I just can't see.
Interphalangeal are the joints between them. What is this bone called? What number is it? Sorry, now my hand's moving. What is the toe next to the big toe called? What
is that the number 2?
Yes. All right.
I'm sorry, I can barely see.
That's okay, but listen to me then. So,
okay.
I didn't mean it by the way like that, but just I meant like, I will guide you with my voice is what I should have said. I'm so sorry. I'm like, listen!
I'm squinting on this.
No, it's okay, sir. It's not the one that's the closest, and it's not the one that's the furthest away. What do you suppose we call the one in between those two? You are right, it's number 2, but what do we call the phalange in between? It's not distal and it's not proximal.
If it's in between the interphalangeal, is that?
That's a good guess, but it's just middle.
Okay.
Yeah. Sorry, I was trying to make a point, and it really went horribly wrong. Love you. Good. We'll talk. All right. Okay. by the way, everybody here just described to you the way that we name the phalanges on your, and they did a better job than I did, on your toes and hands. Everybody, toes and hands. So first you pick the digit. If it's the big toe or the thumb, that's 1. Index finger or the second toe, that's 2. Pinky toes and pinky fingers are 5. And then the phalange is either distal, proximal, or middle, right? Miss Young, yes ma'am.
I was just going to say, if you have a tablet, I don't know if it works for computers, but if you can't see something, you can zoom in on what you're presenting.
Yes, and you can also usually you can pin the presentation to your screen so that's all
Yeah,
you see.
but it's still really small.
Still small. Got it. Cool. I got you. All right. Good. Okay. Moving right along. Oh, by the way, do you see how there's space between the fibula and the tibia? There's actually not space in your body here. There's a membrane between these two. It's fascia. You have the same thing in your forearms. And it's called the interosseous membrane. It's the membrane between your two bones. By sewing them together, you can still run veins and arteries through there. You can hook muscles to that membrane. It's kind of like the obturator foramen. It's got a membrane over it. You can hook stuff to it. I mean, a really hard membrane. And so by tying the fibula to the tibia, you make them stronger, but you can still run stuff through them. Interosseous membrane. Okay. So let's talk about these two bones. We are looking at an anterior view, which means we are looking at somebody from the front, right? Some things to show you that you will never see in your lifetime is the medial and lateral intercondylar tubercles. Those are actually for ligaments to attach to later that we will learn about. They kind of give your knee integrity. If you see these, don't call me, call 911. You have killed your client. This is inside their knee. You should never see these. You will feel the rest of this stuff. You will feel their lateral condyle. You will feel their medial condyle. You should be able to feel their tibial tuberosity. What is this area right here on the proximal medial shaft of the tibia? It is the pes anserinus attachment, where the sartorius, the semitendinosus, and the gracilis come together right here. And they all insert in this fascia and kind of run down the leg. Here is the beautiful shaft of the tibia. And I want you to realize, look at how the bottom forms here. It's a very weird end to a bone. This part rests on the talus. This is where your talus lives. This malleolus kind of keeps it hooked on the talus and acts as a pulley that we'll learn about soon. And this is the medial malleolus. So the medial malleolus is an aspect. It is a bump on the tibia. If we look at the fibula, that's where your lateral malleolus is, and it is a bump on your fibula. So these aren't separate little kneecaps riding around down there or something like that. These are part of those bones. They are bumps on those bones, and they do help to kind of keep the talus sandwiched in here, but they also act as pulleys to help tendons run around them. Miss Savarino, please.
Does the ankle joint, the talocrural joint, does it sit on both the tibia and the fibula, or does it just sit
just on the tibia?
Okay, cool.
So the fibula is helping, the fibula, lateral malleolus, so the fibula and stuff is helping stabilizing it, probably keeping the leg there in place, but all the weight is going on the tibia.
That was just confusing the bottom of that picture because it would look like it would touch both of those.
By the way, I think it probably does touch, but it doesn't rest on. It's touching the side. Does that make sense?
Yes. Thank you.
No, thank you. And thank you for using the correct term for the ankle. The talocrural joint. Yeah. Way to butter up the teacher. Miss Carrillo, please.
I was looking at word breakdowns because you know I like to break down the word.
I'm laughing because I forgot. It's been a while. Yes.
Talocrural, that has a breakdown. Talo is talon, and crural is relating to leg or thigh. And then the malleolus is a bony. It's shaped likened to a hammer.
Oh, I'd get that like a mallet.
Mm-hmm.
Malleolus. I love that. Thank you. Thank you. I just like it when you teach me. Okay, somebody's got to, you know. So, Mr. Singletary, yes, sir.
I'm sorry about the pronunciation. The sesamoid bone.
Sesamoid bone, yeah. And by the way, don't be sorry. I probably pronounced some of this stuff wrong, and I've been doing it for 27 years because that's what my teacher told me. So, but anyway, I think it's sesamoid bone.
Okay, is that only on your first toe, your largest one, or is more bones than the rest of the toes?
So I was talking earlier about the kneecap being a sesamoid bone. Did you find out that there's a sesamoid bone on your big toe?
Well, it's not on the, well...
Like, you know the patella is a sesamoid bone, right? Okay. There is a sesamoid bone on your big toe. I was just shocked that you discovered that. Yeah. So
That's why we get. Okay, I guess I jumped too far.
No. Yeah,
Okay,
you didn't do anything wrong. Like, it's great. So let me tell everybody now. So everybody, the prime examples of sesamoid bones in your body, and the biggest example, are your kneecaps. But you do have these bones in other areas of high stress where you don't want stuff to pop out. And when you go walking and your big toe comes down, you don't want it to snap all the way through. You've actually got two little baby, cute, adorable little mouse kneecaps there. They're maybe the size of, I don't even think they're the size of an eraser, kind of there, on the bottom of your foot, helping to, and when we learn the muscles, you'll see where they are, but keeping your big toe in place. So you have a sesamoid bone in each knee, 2 in each foot. That gets you to 8. No, that gets you to 6. You've got 2 in each foot underneath the big toe, kind of helping hold the big toe there. Yeah. And since the feet are like the hands, you've actually got 2 teeny ones inside your thumb here, keeping you from popping your thumb back when you guys are going too deep with your thumbs instead of using your elbows. But anyway, they're in there. They're very hard to feel because they're wrapped in ligament and stuff like tendon and ligament, so it just kind of feels like some lumps in there, but they're in there. So that's where your 10 sesamoid bones are. The kneecaps are just the easy ones to feel. The ones in your toe and thumb are so wrapped up that you just kind of feel it with some gristle in there, but there's a bone inside there. 2 bones. 2 little teeny little mouse kneecaps in my thumb, 2 little teeny ones in my big toe. Yeah, thank you, Mr. Singletary.
Are they easy to palpate, or are they just in there?
You can feel them. Like in my thumb, I can feel them right now. They feel like 2 bumps. It's kind of hard to tell if they're the bone or the, what they are. But yeah, you can feel them.
Okay.
Yeah.
All right. Thank you.
I'm trying to think if you can feel them on the big toe. I don't know. I mean, I'm sure you can. I just don't go around looking for them. Miss Abelos, please.
Real quick, the purpose of the fibula, or I've seen where they've taken the fibula out of people to harvest their bone for, other medical necessities. I've seen that, and they live a normal life. I in my mind, I know that the fibula kind of wraps around the tibia with movement and rotation, but it's not really for stability. I mean, kind of. But what is your take on what the purpose of that is before I go forward? Because it's kind of hotting me a little bit here.
I love that. Ms. Abelos, you're 100% correct. As we say, like when you're working on your house and you're doing a remodel, the fibula is not a load-bearing wall, right? Like I wanted to widen this doorway in my kitchen, and the guy's like, "It's not a load-bearing wall. We can make it as wide as you want." Like, we just knocked it out that day and made the wall bigger. If it's a load-bearing wall, you can't do that. Whereas the tibia is a load-bearing wall, so you can remove somebody's fibula and they can still stand. That said, I think your body is one of the 5 bazillion miracles of your body is that it's got kind of overlapping stuff. You've actually got extra stuff, right? Which is why people can get along with 1 kidney, right? So why do we all have 2? Well, because they're super important. It's kind of good to have a backup. And why we have overlapping muscles. So like my hamstring should be flexing my knee. But if I have a pulled hamstring, my calf muscles, the gastrocnemius especially, can kick in and help. So I think the fibula is just a smaller player, right? But it's not holding you up. You're absolutely right. I do think it helps to stabilize your ankle. And I would worry about ankle stability. And I would guess, I don't know, I would guess those people wouldn't really be good at lateral movement sports. Like if they're shifting back and forth a lot, they don't have that same kind of ankle stability. I think they would lose some of that. But you also have a boatload of fascia down there that wraps around your ankle. And I'm sure it would compensate. So just because we can remove it, though, doesn't quite mean it's... And you weren't saying this, but in my mind, just because I can remove it doesn't mean it wasn't important structurally. It means that my body's pretty darn good at compensating when I pull stuff out, which we do all the time, yeah. But she's exactly right, guys. And actually, I love that she asked this question because we do need to remember that. And it's what Miss Savarino was also asking too, right? It's the tibia. It's the tibia that connects directly with your femur and connects directly with your foot, and the fibula is just a little helper. Yeah, totally. Totally. Agreed. Yeah. Okay. This is a back view, a posterior view. Just think about stuff I want to tell you about. One of your hamstrings attaches back here. But here's what's really interesting. This is your medial malleolus. And there's a groove here for the tibialis posterior and the flexor digitorum longus and flexor hallucis longus. So I've been asking you guys, by the way, the 3 calf muscles live back here. I've been asking you guys for 4 months now about the calf muscles, and we haven't gone over the calf muscles yet. We're about to learn about them. They live back here. This is the back of somebody's leg, right? So there are 3 calf muscles that kind of exist back in this area. And all 3 calf muscles come together and hook to your calcaneus, which would be down here. It's not in this picture, but it'd be down here. Well, I will start asking you, not yet, but preview of coming attractions. I've been asking you the 3 calf muscles, but there's actually 6 muscles in your posterior leg. There are 3 muscles underneath the calf muscles that are deep to them. And that one is the tibialis posterior. The other one is called the flexor digitorum longus, and the other one is called the flexor hallucis longus. Well, those muscles live up here. And if that muscle pulls, it doesn't do, those muscles attach to your toes in your foot. They have to go around a pulley to get to your foot and actually be able to affect it. So if you guys do this with your forearms all the time and don't think about it. Like, it's amazing to me, but these are my forearm flexors right here, right? And they work even when my wrist is bent over because a tendon goes up, it goes underneath some flexor retinaculum here and goes around this corner. And so when it gets pulled, it can go around the corner. When it gets pulled from here, it can still affect my pinky, right? It still puppets that, no matter where my hand is. And the same thing is happening on your foot. So there are actually 3 muscles underneath your calf muscles. Tibialis posterior, flexor digitorum longus, and flexor hallucis longus. And as a little preview of coming attractions that will help you with foot muscles when we get to them, and I will say this again. Well, you know me, I'll say everything 20 times. You have 7 big toe muscles, 7 toes that attach to your, just 7 muscles, sorry, maybe I'm on vacation already. 7 muscles that attach to your big toe and move your big toe in various ways. You've got 8 muscles that attach to your thumb and move it in various ways. Every single muscle that attaches to your big toe is called something hallucis. Something hallucis with an H. So it's flexor hallucis longus, flexor hallucis brevis, abductor hallucis, adductor hallucis, extensor hallucis longus, extensor hallucis brevis. I think that's all the hallucis right there. So what's really neat about knowing that is if somebody comes into your studio 10 years from now and people do this, and they try to show off by naming some obscure muscle, and they're like, blah, 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 hallucis, you're not going to remember exactly where that muscle is. You took anatomy 14 years before, right? But the minute you hear hallucis, you know it's a big toe muscle. You know it right away. And the thumb that has 8 muscles going to it, all of those have the word pollicis in them with a P. So you've got flexor pollicis longus, flexor pollicis brevis, opponens pollicis, abductor pollicis, adductor pollicis, extensor pollicis longus, extensor pollicis brevis. So anything with an H in it, hallucis is going to the big toe. Anything with a P, pollicis, is going to the thumb. Just some kind of helpful anatomy advice because we are getting ready to do feet and we will eventually do hands. And just knowing that and realizing, well, the big toe can only do certain things, right? It either extends or flexes or goes in and out. And in and out we call abduction and adduction. That's it. So you're going to have like an extensor hallucis longus, an extensor hallucis brevis, a flexor hallucis brevis, flexor hallucis longus, an adductor hallucis, and an abductor hallucis. So it's just very helpful to very quickly figure that kind of stuff out. And then you can even figure out roughly where that stuff is. Because in order to extend my big toe, I have to be on top of my foot. In order to flex my big toe, I have to be on the bottom of my foot. So on the bottom, if there's a muscle with the word hallucis on it, it's got to be flexor hallucis something, almost for sure. If it's on the outside of my foot and it can pull my toe out, abductor hallucis. It makes life a lot easier for you. So yeah. Okay, so anyway, underneath the calves are the tibialis posterior, flexor hallucis longus. It's called longus because it's way the heck up here, and it's going to go way down here and go all the way around the malleolus and over to the foot and hook to the big toe. And when it contracts, it pulls the big toe down. And then flexor digitorum longus. By the way, you have digitorum muscles in your hands and feet too. They always attach to the digits. So the flexor digitorum longus is goes to your toes. And those three muscles live underneath the calves back here. We will actually do those muscles. I just kind of like, I know some of you like to kind of read ahead, so to speak. Miss Carrillo.
I kept forgetting to ask, can you explain the difference between the digits and the phalange?
Yeah, thank you. It's a great question. You can replace the word digits with fingers and toes. Your digits are your fingers and toes, period. They're kind of a general location. Your phalanges are the bones that make your digits, your fingers and toes. So this is digit number 2, but digit number 2 is made of 3 phalanges, right? Digit number 2 is made of 3 phalanges, distal, a middle, and a proximal phalange number 2. Make up digit number 2. Does that make sense? So digits are your fingers and toes. They are made up of bones called your phalanges. Good question, actually. Thank you. Okay. Moving right along. This is a kneecap. You do not need to know about the underneath of the kneecap. It's meant to be smooth and articulate with the person's, femur and all that kind of stuff. I just meant, it's not that it's not important, but we will never rub it. You will never see it, all that kind of stuff. This is just showing you a knee in a bent position. This adductor tubercle, by the way, is on the femur, and that's one of the places your adductor magnus attaches to. And you can see all the stuff I talked to you about. Tibial tuberosity, which is where all 4 quad muscles insert. You should all know that by now. I will be asking you that. You need to know all your quad muscles insert all 4 into the patella, and the patella inserts in the tibial tuberosity, and that's why you can kick your knees out. And here's the pes anserinus location. This is just a medial view. And that's it. That's really it.